more, but we'll welcome them, and just to be respectful of everyone's time, we'll go ahead and get started. So good evening, everybody, and welcome. I'm Stephanie Berglund, the CEO of Thread, and I'm really happy to have you all joining us tonight for another Thursdays with Thread. If you've been joining us before, welcome back. And for those who are joining for the first time, I'm excited to share that Thursdays with Thread has been a series we've been doing as part of our COVID response and support to all of you. We just recognize that there's just a ton of information to be paying attention to, and lots of written information, and lots of important I guess, resources for you all to be tracking, and thought of Thursdays with Thread is a helpful way to really just connect you with kind of just a live conversation, connect you with experts and resources, you know, for the latest, I guess, in COVID support for you. So tonight's session is all about you. So Thread has been partnering with you and standing beside you the entire time of the pandemic. And we're excited to have a conversation tonight, starting with sharing some of the data that we've been collecting from all of you. So thank you all who've been partnering with us on that. Some trends that we have identified, some of the resources and supports that we've been connecting you with, and then we're going to have a chance to kind of dialogue together more about, you know, with the turn of the new year, what we can do next to support you. So before we kick off, I'm going to have Cassie, our great education and training director, share some housekeeping for tonight's session.
Great, thank you, Stephanie. So I changed the slide there for our Zoom website controls. I know many of you have taking advantage of Thread's free training right now, which is so great, but just a reminder that it's really great to see people in video. It really supports interaction. If you do not have video capabilities, or you know, you're on your phone or your internet bandwidth doesn't support that, we're still happy to have you join us, but we encourage video when possible. To avoid feedback and distractions and noises in the background, you know, we encourage you to stay on mute if you're not speaking. However, you know, we do want you to participate, and you're welcome to take yourself off mute to ask questions, to contribute to the conversation. You know, and then, of course, like Stephanie says, there's going to be opportunities to discuss your needs, and we very much want to hear from you this evening. We also, like I said, you can use the chat to ask questions or comment, and Melinda and I will be kind of monitoring that and helping Stephanie with that. If you have multiple people sharing on the same device, and I said this a little bit at the beginning, but you know, if you've come on since then, if you've got multiple people sharing the same device to attend this evening, please send me a message in chat that with everybody's full name, so I can make sure that everybody got credit for attending tonight. I did start the record on this just as Stephanie gave her initial remarks. You should have gotten a prompt indicating that you understand the session is being recorded, but just want to reinforce that. Training hours can be earned only by attending the live session just now tonight. The link to view the recording is made available on Thread's website for informational purposes only. In addition to your attendance tonight, to receive a certificate, you must also complete the evaluation, and I will provide the link and the code for that at the very end. So I'm pleased to introduce Stephanie Berglund. She already kind of, you know, introduced herself a little bit. She's our special guest speaker tonight. She is Thread's Chief Executive Officer, and as her role as Thread's CEO, she provides leadership, vision, strategic direction for Thread's network, and collaborates with state and national partners in order to advance the quality of early education and child development in Alaska by empowering parents, educating childcare professionals, and collaborating with our communities. So please welcome Stephanie.
Thank you, Cassie, and welcome again to everybody. Just want to start by a moment of thanks and celebration of all of you. We are closing out 2020, and it's been a doozy of a year, right? And I just want to pause and thank you all for all the incredible work that you're doing across the state. It is really remarkable, the incredible love and care and all of the education you're providing to our young children and families now when they need all of that love and support more than ever. So I appreciate all the work that you're doing every day. I know it's a heavy lift, and I'm going to share some information with you today, and know that none of it is to try to convey your experience. You all are living and breathing the COVID pandemic every single day in your programs and in your lives. And we've been standing back to support you and alongside you, and are going to be sharing more about like what we've been observing and gathering in terms of trends and data and information. So want to share from our perspective for about the first half hour of our time together tonight. And then we're going to do breakout sessions, so you can please plan and prepare for that. So we're going to put you in a small group and have some prompted discussion, and then bring you back so we can kind of share. We have lots of people on tonight, but we're going to share so that we can share our voices and collective needs for turning in the new year and where we want to go next. So bear with me, I'm going to set up sharing my screen here, and we'll start. Okay, so Cassie, you'll tell me if this is right.
Yes, I can see your desktop.
Thank you. I'm going to start the slideshow from the beginning. Okay. Can you see that?
Yes.
Okay, good. All right. Step one is getting the screen share right. Okay, so like I mentioned, we're going to be I'm going to frame my beginning remarks kind of in the context of childcare, then, now, and next. And again, from how Thread has been experiencing the pandemic with you and gathering that information. So we're going to talk a little bit about trends and identified needs, some support and response, some current resources that are helpful for you to be aware of, and then turning to most of our conversation on what's next and what's needed. So let's rewind and take a step all the way back to March and take a look at what was happening in the sector from the very beginning. So as you all are well aware, there was no government mandate early in the pandemic for childcare to open or close. So we saw in those beginning months, starting in March, April and May, that about 50% of childcare programs across the state were open and half were temporarily closed. It's no surprise to you that, we were quickly identifying needed support, navigating communication, through the state of Alaska, licensing, mitigation direction, mandates, and also, how to navigate CDC guidelines for health and safety. Some of the biggest trends that we saw, and we know you all experienced, were kind of immediately seeing and feeling decreased enrollment. Yet at the same time, you, of course, were experiencing increased operating costs. So you immediately told us you had to add staffing. All of you added an incredible amount of extra sanitizing, health checks, training, and mitigation planning. And that translated into needing more supplies, more workforce, behavioral health needs were on the rise, and also new attention to HR supports and resources as well. So much was happening so fast. We don't need to remind ourselves of all of that, but just the needs were evolving so fast, the community dynamics, the science and understanding of the pandemic, really was difficult, and including all the planning that you had to do for mitigation. And at the same time, your customers, your families were also experiencing, a high amount of stress and also had changing needs. We heard from families, both from information from you and also the families that we serve through our referrals, that they weren't sure how to navigate childcare in COVID-19. They weren't sure it was safe. And what I'm so proud about from the very beginning was how resilient and quickly you all pivoted and adapted, because that made it so easy for us to express confidence to families who were shopping for childcare, to say, yes, it's safe, and our childcare programs are stepping up and having incredible response. So along with you, Thread quickly adapted, our service delivery. Like tonight, we quickly pivoted to provide all of our service delivery through virtual support, and immediately started to identify gaps of what was needed to help the childcare sector. So one of the things we identified early on was a financial gap. Like I mentioned just previously, with your decreasing enrollment, yet which is, we know, your highest revenue source, with increased operational costs, we knew there was a gap that immediately needed to be filled, a financial gap. So we quickly identified about a $10 million per month gap that's needed to stabilize businesses and childcare. And we still are talking about this number still today. As you know, as the pandemic has continued on, we are still very much in a mode of relief and support needed during COVID, and have not yet started to turn the page for recovery, but still recognizing huge relief efforts are needed. At the same time, we surveyed many of you and programs. So in June, you may have remembered getting a phone call from us, and we called all licensed programs across the state of Alaska in the months of May and June, and asked you, what are your needs and how can we support you? So we were able to connect with 304 programs, and this is no surprise to you, I'm sure, but the top need is funding. In early on in the pandemic, you said we need funding in order to weather the storm, and second, we need help with supplies. And primarily, just about 60% said, with a focus on cleaning and sanitizing supplies. That's no surprise early on in the pandemic, when we were all scrambling, and I know more importantly for businesses with bulk needs like you all, for necessary cleaning supplies. Staffing also surfaced as a need. We know some people have left the field and there were changing dynamics. So while you were serving fewer children, you also had expressed and identified 23% needed additional staffing. So some of the early response to your needs that Thread supported were standing up more communication. So hopefully you have all visited by now Thread's COVID-19 Resource Center on our website. It's the first main button and link on our website when you go to threadalaska.org. We additionally are sending out every Friday Thread Weekly e-news to keep you up to date of COVID resources. So please let us know if you're not yet receiving that, so we can sign you up for that. And then we started this series, Thursdays with Thread. So scaling our communication was really important. And we, again, like I said early on in the introduction, recognizing that you all are getting inundated with a ton of information, it's super hard to navigate and follow all of that. And so we recognize and set up the COVID-19 Resource Center is really a one-stop shop for you all to support you with knowing what funding is available, knowing what tools, resources, and news that you need to pay attention to. You can find always on the COVID-19 Resource Center. In June, we also did fundraising and gave out a first round of what we were calling a Quality Initiative financial support program. So in June, we supported the sector with $412,000, and that went out to over 300 programs. Awards ranged between $750 and $1,500 to programs. And in addition to our fundraising, we we're focused on a lot of advocacy around the communication and trends that we were hearing from you all about your needs. I just want to add that the funding that we provided in early June was made possible by partnering with several of our great supporters. And I just wanted to give a shout out to the State of Alaska Department of Health and Social Services, who's been a partner with us and you all along the way. The Rasmussen Foundation, the Community Foundation, and Wells Fargo supported those early efforts. So in addition to our response, I mentioned advocacy, and with that $10 million gap that we had identified early on, you may recall that the federal government provided federal relief across the country called the CARES Act. And for the money that Alaska received, there was a state allocation for childcare, and then they also gave money through local governments to support COVID-19 relief needs. So one of the ways THREAD advocated for you was encouraging the state to give as much money as possible to support childcare needs. So their federal requirement was allocation, I should say, was to give a little over $6 million to childcare. And we're so happy that the state responded with even more and provided the sector with just under $20 million. So that's a huge investment from the state of Alaska, and so proud that they were able to support and use CARES money to support the childcare sector. We were also advocating, like I mentioned, to local government, and THREAD was advocating that every local government provide at least 10% of their CARES allocation to childcare, with the exception of the municipality of Anchorage. Because of its size, we were advocating that they allocate at least $30 million. So you can see an example here of a breakdown of which local communities did provide a specific set aside and allocation to childcare. We're really proud and thankful of this local CARES investment. So it was really over $18 million. So I invite you, if you are from any of these communities, to outreach to your assembly and borough members to say a big thank you for that specific allocation. And we know in many other local governments across the state, they also provided small business grants that many of you may have taken advantage of well. But just wanted to highlight that these programs in specific provided allocation just for setting aside money for childcare, which is incredible. So we're really proud of the governments across the state for supporting the sector at this time. So let's talk about what's happening now. So I mentioned early on that about 50% of the programs stayed open and 50% temporarily closed. Now, across the state, 80% of licensed childcare programs are open, and about half are enrolling, and 14% are still temporarily closed. For most of the programs that are temporarily closed, many of them are attached to infrastructure or building that is also closed, maybe a faith-based entity or a school. So wanted to just highlight some examples of where we're seeing some temporary closures. And really, as we'll see the data in just a second, that overall programs, which we're excited to hear more from you, are really still struggling. I know you've all, probably and likely experienced maybe a positive case or a close contact that you've had to navigate differently. There's an uncertain financial outlook for many programs, and there's still a need for access to supplies. So some of the efforts that have happened lately with COVID trends evolving and more programs open, we knew we still needed to provide linkages for you for financial supports and supplies. So this month, actually just this week, we're finishing sending out $945,000 to programs across the state of Alaska. I hope some of you have been recipients of those checks in the last week to 10 days. Those awards were a part of a $1 million grant that THREAD received from the Alaska Community Foundation. So we're really Thankful and grateful for that support to pass that along to you. In addition, we started a program through Alaska Seed, awarding $500 to early educators who are eligible for those resources. And if you've applied for that and are waiting for that, we are beginning January 1st to process those applications. So expect to hear from us soon. We also partnered with the Rasmussen Foundation and UAA College of Health on a PPE survey. So PPE is short, of course, for all the necessary supplies that we recognize that you need in order to provide safe and healthy care and education to children. So, and then, of course, collecting more data from you to inform really the funding that you've received and what you need and what's next. And we're going to look at that in just a second. So I wanted to highlight the PPE survey. Hopefully some of you may recall participating in that, and wanted to share a few of our findings from that. That the highest needs that we collected from that were a need for disposable masks, gloves, and cleaning supplies. So that mirrors what we learned from you in May and June. And we're excited to share that supplies may start to be distributed to some programs. And that's actually not a program that Thread is helping to select and distribute, but one that's being facilitated through the Rasmussen Foundation and UAA in partnership with Christian Health Associates. So we don't have a way of knowing who will be receiving supplies or not, but you may be receiving a special gift of supplies if you participated in that survey. And then just wanted to call out again, the COVID-19 Resource Center. There are still financial supports available to you as childcare programs and as small businesses. So you can pay attention to that website for the latest information. We are adding information every week, adding news, resources, tools, and information to support you. It's really the best source of the current and latest information. And we're going to share this PowerPoint on our website and in this recording today. So I know this is a text heavy slide with these links. These links are also on our website in the COVID-19 Resource Center. But just wanted you to know that there are several places that you can be accessing supplies that you need. So you can be requesting PPE through the Emergency Operations Center, and several bulk supply resources are available for you. So I wanted to provide those resource links for you here, and just mainly share and have you know that those resources are available to you. So let's now turn to look at the latest data. So for those of you who participated and applied in our last, the second quality initiative, that was 256 programs across the state. And that's not all programs, but about 64% participated. And what we heard is that the childcare sector is at risk. So what you can tell from this slide is on the right side that 33% of programs, that's the yes kind of piece of the pie there, are telling us that they are concerned about closing. And that is up from on the left side, who said that they were considering closure since March, so since the beginning of the pandemic. So that's an increase as people look forward to the next year. We know that people are considering themselves at risk of possibly needing to close. We can assume that that might be a little bit higher. As you see in the purple box, the purple section here, there's about 148 programs that we did not hear responses from. So there's a big piece of unknown information here as well. You told us that what you would really like is more children. So many of you are beginning to and have been open to enrolling new children. And that's great. That's really telling us that you are ready, that you're resilient. have normalized your mitigation plans, feel really confident in your health and safety practices, and want to serve more children. But we know, and as you know this too, that families, many families are still keeping their children at home right now. Some families have had a change of employment or lost their jobs in their homes, so maybe they can't afford childcare right now. So we know that demand is temporarily low, and all the more reason to continue to support you in weathering the storm until we can really focus and turn the page to more recovery. Here's kind of a picture. We asked you about your desired capacity, and those who responded to the survey told us that most of the programs across the state are serving between 51 and 75% of the capacity that you have, and that you would actually like to be serving more. So, of course, following CDC guidelines, you know, we would want you to be serving as many children as possible. We know that children, of course, we talked about this earlier, are and their tuition is your greatest revenue source. So we know that that will help you the most in your security as a business. So this is really text heavy, so I'm just going to leave this up for a minute. We asked you, you may recall, what federal, state, and local supports that you received funding for. So all of this data is, of course, self-report. There's no way we have to validate or verify this. And it also is only representative, like I said, of the programs who replied to our survey. So again, that was like 64% of programs. So there are roughly about 200, family childcare and group homes across the state. So this is data from our family childcare and group homes. So this is not collective of all programs across the state, but just of our licensed family childcare and group homes. You can see here that about half of the family childcare programs received money from the state, but fewer than 25% of those who responded to our survey received other supports. Similarly, there's about 200 licensed centers across the state of Alaska, and you can tell by this first column that very few programs applied for monetary support, and you can see here that most of those received, between $20,000 and $50,000, which we asked a range if you filled out that survey, so that's why it's represented in that range. The other financial support that was available, of course, we've already talked a little bit about Thread's quality initiatives, and so we are happy to share that 100% of the eligible applicants received funding from Thread. So in our approach, we've been really taking kind of a mile-wide approach in supporting all programs who applied for and needed support. So you can see here that like we talked about earlier, we did a Quality Initiative 1, which is that first bar in June, and then the Quality Initiative 2 that was just paid out this last week.
So Stephanie, on that, talking about the quality initiatives, there's been several people have said thanks and how appreciative of their funds. And then somebody's asked, and I forget, this is awful, I should know this, but the funder that just supported this last quality initiative, is there a way that they can reach out to them and thank them directly?
Yes, that's great. That was the Alaska Community Foundation, and we can provide you with that information and send you an email to send thank you. Actually, when you're in your breakouts, I can look up the name of the person to do that, and we can provide that in the chat when you all come back.
Thank you.
Yeah. Are there other questions, Cassie? I know I've been talking a lot.
No other questions,
No, yeah.
Just the thank yous.
Yes, you are welcome. We're happy to provide you with that, and I wish we could do even more. So we asked in the survey, you know, what is the greatest anticipated need to remain open in the new year? And most of you said additional enrollment, which we talked about earlier, and continuing to get support for additional funding and supplies. So wanted to just share our analysis of the data, and then we're gonna, in just a minute, put you in breakout rooms, and would love for you all to start with a reflection on this data too, and have a conversation about that. But we're, Thread is really feeling like the early childhood programs are at risk of collapse. And we know already the sector is operates on thin margins and feel like there is continuing risk, and that's become more unstable and just of having kind of an unsure future. We are seeing, of course, enrollment stay really static, lower than you would like. We see and hear that staff recruitment and retention remains to be an issue. Some of the open-ended responses we received in the survey talked a lot about staffing. So I'm interested in hearing more from you on your staffing and workforce needs. Again, we know that we're also hearing trends that you all are supporting your families in new and different ways. We're hearing stories of some of you supporting your families financially, providing food and clothing for your families, and really see them as part of your extended family and community. We're seeing the COVID spread in childcare really mirror community spread. That's not a huge surprise. And our analysis is that the survival of as many programs as possible really requires more financial support and supplies. So we're seeing a lot of the same trends nationally. Some of you may have participated in the NAEYC survey. This just came out a few weeks ago of findings that they did on their latest survey of early educators and early childhood education programs across the country. This is a national trend slide and really kind of mirrors, again, what we're hearing from you all and seeing in terms of numbers and information across the state. But let's turn now to talk with each other. I know I've been talking a lot, and we'd love to do a breakout conversation, and then I might come back to a next conversation. Does that work, Cassie? Yes. I'm gonna jump to the breakouts and then come back to the other. So what we'd like to do is we're going to put you randomly in small groups for 20 minutes. Let's do 20 minutes. And you'll start by selecting a facilitator and a note taker to report back out. And what we'd like for you to discuss is kind of what's your reaction or response to the data that I just shared and our analysis. What are your greatest needs? What do you need next? And what would you like and what do you need from Thread next? As I mentioned, we have been kind of providing support to all programs that we know need it and spreading that out equally. And would love to hear if you like that or would like us to do some more targeted efforts and initiatives, maybe following the greatest needs. So Cassie, do you want to give us a little bit of housekeeping for the breakouts?
Right, so when I go to put you in breakout rooms, you'll get a little pop-up saying you've been assigned to room number, and you can click to go into the room. It looks like, Stephanie, we've got 40 people. If I do 6 rooms, that's 6 to 7 people. Is that good?
Yeah, that sounds great.
Okay, I did just put the questions in chat as well. You should be able to view those from the breakout room. And as Stephanie said, if you can have somebody that can help guide the conversation, and we do need a report, somebody who's taking notes and can report out. So when you come back, you can share, one item for each one of those questions. Are there any questions from the group before I put you into rooms?
Yeah, I just want to underscore that, I mean, have a generative conversation, but I think for the report out, it'll be helpful if you just share one collective response to each of these questions for the report out. So each group will just share kind of 3 quick pieces.
Hello, I have a question.
Yes.
I didn't realize that this was for just like directors or whatever. I thought it was for like, I have all my employees on this meeting, so they're not really going to be able to answer any of this.
I think that's okay. I think this is still really informative for them. And
Okay.
I think it might, and Stephanie, I don't know if you want to speak to this. We want to hear from all educators, not necessarily just administrators.
Okay. Because I know some of them will just be like, oh, I don't know, you know.
That's a really
Okay.
great question. Yeah, and I think this session is for anybody and everybody, right? I mean, we're all experiencing the pandemic differently, and that's both from early educators and as program directors. So yeah, I mean,
Okay.
feel free to speak from your own experience,
Right.
what you're experiencing, what's happening in your program with your coworkers, and for yourself. And we would love to
Okay.
hear that, what you'd like from us.
I'll just let them make their determination. If they want to stay on, they can stay on. If not,
Great.
then. Okay, thank you.
Thank you.
Okay, great. Any other questions? Going once, going twice. Okay, I'm going to go ahead and start those breakout rooms. Once you're in the rooms, if you do have questions that need support, there is a button where you can ask for help and I can pop in. So I want to make sure you knew that was available as well. All right, here you go.
Thank you.
You're welcome. Okay, I see people are starting to kind of pop out. Young, do you need help? Did you get your button saying that, looks like Ambra, did you get your button saying to join a room? Lucero, did you get a button to join your room? If you didn't, I can invite you again. Hi, Lucero, you can take yourself off mute if you need support.
Hi.
Hi.
Um,
Ayudante.
I help her for the Zoom. She needs to join a breakout room, I think. Or
Yes. So do you have the pop-up button that says to join the Zoom? It looks like you're assigned to room 5.
Ok, entrar, dice ahí.
Oh, yes.
Okay.
Yeah. Thank you.
Thank you for helping. Great, I'm glad you're able to participate. Okay, should take you there directly. There you go.
Jenny, who let you in?
Okay, just a reminder, Stephanie, anything you say is being recorded.
I snuck in the back door because I just wanted to hear the conversation. And
Okay,
I gotta finish a couple
somebody's
things.
asking for help, so I'm gonna go join them.
Okay.
It's a great presentation. It's good information.
Hi, your group's already done? I can't hear you.
Yeah, they were pretty quick.
Oh, super.
I took some notes. If I
Okay.
guess that calls me the facilitator.
Well, thank you. Appreciate that. Looks like some of
Thank
your
you,
groups
guys.
come back now. Yeah.
Essie, how much time is left? I don't have a timer.
I thought we had about 10 more minutes, but it looks like this group's already done.
Great. Well, you guys are welcome to hang out or take a break if you want.
Hi, welcome back to the main group here. We're just we've got about 10 more minutes. You guys were fast, which is good. You must have had an awesome conversation. So you just want to hang out and take a little break. Okay, for those of you hanging out here in the main room waiting, we've got like 2 minutes. I've been giving them minute broadcast warnings, and I will close their room and they'll have a last minute countdown. So they'll all be joining us again real soon. Welcome back. Great, people are popping back.
I'm back, right? Yep.
Yes, you
I can-
are. Welcome
Okay.
back.
Okay.
We'll just give another minute for all of the groups to come back.
There's about 9 more people in there, but they've got about
Okay.
20 seconds.
Okay. They must be having a great conversation. Thank you all for chatting with each other for a few minutes. All right, that looks like the group. Welcome back, everyone. Thank you for taking that time to connect with your peers across the state and chat a little bit about our questions. So again, would love to hear from each group, and just to start the conversation, if you can not share your whole conversation, but just a highlight of one thing you talked about in terms of response to the data, maybe a greatest need that you all identified in your group, and then what you would like from Thread moving forward in the new year. So do you all remember who was group 1? Or we can just ask for a volunteer. Christina.
We were group 1, thank you. So in the response to the data, it said wasn't a surprise. Some of us said our answers would be different versus October than what they be now, because all that funding has had to be spent by the end of this month. So while things look good in October, they look not so good now. The greatest needs was continued funding to support this. More staff, especially with our home providers and the group homes. When there's an exposure and they're having to come out, they don't have the extra staff to cover that. And so that's a huge concern for them, especially as more and more districts are going back to school and the case rates go up. And then what do we need from Thread next? Continued advocacy, continued free training. Really appreciate that. And we didn't talk about it, but I'm at it, is I think just continue a campaign explaining about how to do, not only like for how we can provide this safely, but for families in the community, that this can be done safely. And this is what we're doing so families will feel secure in having their children in places like this. Because as the community spread has gone up, that is where I think more and more families are even just choosing to poll. That's my experience. So that's what we had.
Thank you, Christina. And all in group 1. Thank you. Group 2.
Okay, Stephanie. I think she took our speech. The group 1 was the same.
Irma, tell us about your conversation. You can repeat it. That's okay. That reinforces
Okay.
it, right? So go ahead, share your top ones.
We don't talk too much about the stats, the graphics. We are more focused in the greatest need is funding to because programs are losing money because we don't have enough kids and to cover the operating cost and supplies to keep our facility, clean and hygiene, like paper towels, toilet paper, gloves, cleaning supplies. So I think the greatest needs is funding to keep going.
Great, thank you. And did you all discuss what you need from Thread next?
Funding.
Okay.
Yeah, funding too.
Great.
And Joanne
and
shared with us a place where we can get gloves for cheaper price than the rest of the places.
Great. So access to knowing more about where to find maybe bulk supplies and them at affordable prices, right?
Yes.
Okay.
Mm-hmm.
Thank you. Anything else you wanted to share?
My colleague, the first one, made most of the stuff she said we share too in our conversation. The same.
Thank you.
Thank you.
Oh, I have something to add and keep the free class. It's really making me feel good.
Oh, yeah.
Good. The free classes. Thank you.
Yeah. Thank you, Joanne.
Yeah, thank you, Joan, for adding that. So we're gonna open it up for a group conversation in a minute, but just want to give everyone an opportunity to just share highlights from their group. So thank you for that, group 1 and 2. Who was from group 3?
I'll take that one. I'm just gonna build on what they said because like group 2 said, everyone's really just kind of agreeing. We also focused a lot more on, also on needing more hands-on support, which we understand can't be done yet, but also like mental health support for the staff as well, because COVID is stressful, to put it lightly. We need help with like PPE and like behavior health with the kids because they don't know how to process, and we're struggling to teach them because this is all new.
Great. Thank you, Heather. Let's come back to that at the end. I'm interested to have more of a conversation about that. But anything else in your high-level list from a report?
Like I said, just scaffolding on them. We need funding. We need more kids. We need more supplies because we go through so much more than just households do.
Right. Thank you for that, group 3. Who was from group 4?
Group 4 over here.
Great.
So on the first question, we all kind of agreed that response to data, we all agree that it's accurate and it represents everything well. On the second question about the needs, everyone agreed that we need more free training. We all love it. And the biggest concern everyone shared was how to enroll more children, that everybody's suffering from losing kids due to either parents staying home or because parents don't feel safe to send their kids because of the coronavirus. Like in our personal case, we actually lost a good chunk of kids because their parents don't want their kids to wear masks. So how to help families with that and understanding, and even just to teach the kids. Then the third question on what to focus next, it's again, we agree with the first groups on the second wave of financial support for the next year. And to maybe help out focus on the smaller, more isolated communities and help fund them as well more. And just any ideas on just how to enroll more kids so that we can have more business. But yeah, we agree on all that, everything the other group said. Thank you.
Thank you.
Can I say something?
Yes, please.
It will be a good thing. Do you know if they're getting books for children with masks on and all kinds of stuff like that? Because sometimes the little ones, they get really scared, like to put on masks and stuff.
That's a great question. We can look into that. And I'm looking at Cassie because,
Nora. Yes.
I love that idea, right? I know I was even driving around my neighborhood, even I've seen people who are building snowmen, you know, put the masks on.
Yep.
Right? They're so fun. But yeah, I think if there's children's books or even dolls, you know, that we can find that help model and support that for kids. Joan, did you have a suggestion?
Yeah, that's what I do too. I have I like a video where the kids would put their mask on too. They love wearing their mask because their parents tell them about it. And I have everybody tested for COVID. I myself do it too, for my family, so everybody can be safe. Yeah. So it's a good thing that they have their doll practicing too, and they're really good at it too. Yeah. So they keep it on. I keep mine on so they can keep theirs on. So we have to live by example.
So in response to children's books, I did a quick Google search, and there's Sesame Street Heroes Wear Masks.
Yes.
Smiling Ear to Ear, We Wear Masks. There's actually quite a few things out there.
Yes, it does. Yes, it does.
I learned something.
Mm-hmm.
But that's really great. You know, that's good feedback for us that we can be helping connect with some resources like that to help you. That's great. And I do want to come back to talk more about the hands-on supports that you need. But let's finish out hearing from our group. So I think that was group 4, right? Thank you. Group 5. Does anyone remember if they're group 5? Or who would like to go next?
Well, I can share for group 5. I was just in my car and I had somebody else take the notes, but I was kind of like the chitty chatty person. So I think, you know, one gal was feeling like her numbers were better now than they were in the beginning. One gal was, you know, hoping for more numbers. I think as far as the needs from Thread, I think they all were very appreciative of the free training. There weren't really anybody sharing major needs that I noticed. But I think, you know, we're all kind of in the same boat a little bit. So I don't know that we could really add too much to the discussion that's already been added, but there's our 2 cents.
Thank you so much. I appreciate you stepping up to report out for group 5. That's helpful information. How about group 6?
Looks like group 6 was Lupine, Maria, 2 Marias, Aria.
Okay, I just didn't know our number. I'll talk. There was only 3 of us actually chimed in. The rest were silent. But what we basically kind of talked about was their numbers are low, so we need more kids. Funding. It was, again, mirrored of everybody else. Another one, someone said too, I don't really know the answer for it, but I'll shoot it out there. I feel like a lot of us, and including them, with the fact that there's remote learning, we are doing so much more than we were before. We are teaching the littles like we do and taking care of them, but then in a completely separate room, because it has to be quiet, we have numerous remote learners doing this. And we're like, I mean, if there's one or two of us, you know, yay. But if there's, I mean, if there's more than one, it's yay. But a lot of us is just one. We have like group homes to in homes in these smaller communities. So, and when we say we lost our numbers, you know, I mean, we have like at the most 8 to 10 kids. So when we lose even just a few, that's over half of our income. There goes, how many bills are we going to give up? So losing these kids was huge for these smaller, and then we feel like kind of we're doing more work. But also with the added of COVID now, it's true what the other one said, having parents not feel safe. You know, I lost quite a few of mine at the very beginning, but I started, because I took this pandemic very seriously, I reached out to it's a different office. It's called Kenaitze down here. It's the tribe. And if you have kids through them at all, or have, or signed up, they reached out to us and said, are there things that you need that we can help you with? And they have literally been coming physically and dropping off cleaning supplies on our front door. Like literally doing it. Paper towels, toilet paper, gloves, cleaning, you know, spray. And to boot, I was showing these people in my group what they also bought for me. And I went a step further. I bought a UV sanitizer. And it literally sits in the middle of my room. I dump out all my toys, I shut my door, and I press the remote. And for the next hour, it literally sanitizes everything that light touches. And it has reduced the amount of everyday cleaning that I have to do, also with the peace of mind that my room is sanitized with just that one. You know, I still go by and obviously do my bleach cleaning like, you know, crazy. But because I did that and went through and reached out to people and told them the kind of things that I go through, I got kids back. They started coming to me because they feel safe with their kids being here. And so finally my numbers have risen. So I think that is something, you know, let those parents know that this is the kind of steps we're going through, and they will feel safe bringing kids back or bringing kids to you because you're doing that, going that extra step.
Thank you for sharing that.
Yeah.
That's a helpful resource, I think, to share with everyone, to be checking with their local tribal organizations for supports and resources. I know those look a little bit different in every region, but I know that there's some available resources that might be available also. So thanks for highlighting that. Thank you, Group 6.
Thank
Cassie,
you.
was there a Group 7 or was that it? Okay, so we got everybody. Please raise your hand if you feel like you did not hear a report out representing your voice in your group. And we will now open it up for just kind of a general conversation. Was there anything in your groups that you feel like is important to add that we didn't hear in the summaries, like either from the person who spoke from your group or from another group, that you feel like was a really, really important piece that we missed? Or do you feel like overall, like the gist of your conversation was captured in the last few minutes? You can give a thumbs up, or you can chime in if there was something big that we missed. It sounds like there was a lot of consistency, which is good.
So Stephanie, in the chat, several people said the free training is huge. They absolutely love the free training. And then River of Life has one of the challenges with the school age children doing remote learning, and they're different grades and they're meeting at, you know, different times throughout the day. And so it's a challenge to adjust their daily routine and accommodate that remote classes for the school age students.
Great. Thank you for that, Cassie.
And Stephanie, I just want to emphasize, I think it was Christina from Group 1 we hadn't talked about this in our group, but when she said it, I was like, yes, you know, how if we took the survey now or in January versus October, you know, our lifeline, I think I can speak for a lot of us, not all of us, but our lifeline has been the state and local funding sources that just have helped cover the operating costs while enrollment stayed low. And I think when we know that there's, stimulus bills in play, we're hopeful for that, but the future is daunting with low numbers, and I guess one of my questions for you all is, is there any knowledge of, or do you have any plans to do a survey to families or an economic survey that's really looking at how many parents plan to have need in the future for childcare, because COVID has potentially shifted people's opportunity to work from home. They might have more flexibility with their work schedule. So as we look and plan to the future of recovery, what will recovery look like actually? Will we ever regain the same numbers? I'm just curious if there's been any surveys or data in that direction.
Thank you for bringing that up, Melanie. That was one of the things I was interested to hear from you. I mean, building off of what Christina said about maybe a campaign for families to know childcare is safe, right? But that's only one element, right, of their decision making. To your point, like, do they have a job? Do they need childcare right now? And when will this temporary lull in demand change or shift? And when can we all expect that? I think is $1 million question. We don't know, right? We don't know how much longer the pandemic will go on. Like I said earlier, we haven't really even started to shift to recovery. As you all know and are experiencing, we're still in the middle of this. We're still very much in a crisis response. And while we all are adapting to that and have plateaued into some new normal, that doesn't mean that, we're through the woods, right? So I think we need to have more of that conversation, and that input is helpful. We're exploring how we do get that information from families. And I would even extend that further to businesses, right? I mean, businesses for their employees, what are their plans? What is their outlook for when they would bring their employees back? Or what is their expectation for dependent care if they keep, their employees at home? So we have a lot of information to still capture and try to gather, and so many unknowns still that we all have. So to my knowledge, the only parent surveys that have been going out are, and you may have seen these, we put them on our website and on our Facebook page, so follow us there if you're not already, are from the Department of Health and Social Services, and they've been capturing kind of household surveys. You all can take those surveys, but then give them to your families as well and pass it along. And so they have some helpful information. They're not specifically about childcare, but childcare is included in the questioning in there. So we can try to capture that, but it's helpful to know that that might be something you would want, Thread to consider doing in the future. Thank you for sharing that.
Yeah, thank you.
So I wanted to go ahead, Cassie.
I was gonna say another item in the chat. Jessica from Petersburg says that there's a need for school age care, after school care, and then with the small community, that's the support that they need.
Great, thank you for sharing that. Yeah, keep adding in the chat if there are identified needs, or you feel like something you want Thread to consider to support you next, that that's coming to you through this conversation, which is great, or that you feel like you talked about in your group that we missed. But I want to circle back to and have a short conversation before we close to what Heather brought up about kind of some hands-on needed support. So Heather, you brought up, and I don't want to put words in your mouth, you can correct me if I get it wrong, but around like needing supports around mental health, and for yourselves, I hope, and for your staff, and for the kids and family in your care. So can you all share, like, what would that look like? Or if you can't articulate what it would look like, maybe share a little bit more about what are some of the experiences that you're having, some themes of experiences?
Well, I know for my center in the past, we've had Thread come out and help us create plans for children and plans for rooms. And with all this, I realized how much we miss you guys. We
We
miss
miss
seeing
you
you guys come
too.
out. I guess I didn't realize how much of a bigger help it was than I thought. I mean, I still get support from my thread rep. She's fabulous, but there's something about being in person and getting the hands-on help. Another thing I mentioned in our group, and I don't know if it's as big a thing for everybody else, but my center is having problems getting professional development people to come out and do CDA observations, because we've got people who are still working on it, still excited, but they can't do nothing till the world opens, which if that ever happens. But mostly what that meant was we need outlets, or we need people for the kids for the classrooms. And yeah, for the staff too, but help the kids helps the staff.
Yep. So starting with the kids, it sounds like. So are others experiencing that? And Cassie, I'm going to queue you up after we hear more for you to share what is available maybe at a high level and how people can still get CDA verification visits. That's important. So are others experiencing that with children? We heard early on, I'll just add that some more behavior challenges showing up, you know, some regressive behaviors, including kind of toileting, nightmares of children, you know, some, you know, trauma and stress with families. So I'm interested, you know, if you need supports, you know, specific supports for maybe behaviors or family supports that are needed right now.
I have a question. So now that they have the vaccine, you know, are we gonna get like how a letter or something? What is it made of or something? Like I'm really scared like to put it on because it's something so new, and that's the only thing I'm worried about. So are you guys gonna have like information about it or?
Yeah, that's a great question. Thank you. We can, you know, provide some resources and I'll put a note for our team to add that to the resource center of where you can find out more information and really the science behind the vaccine. So you may have to do some of your own reading on that, but we certainly can provide you with the right links and trusted sources to be looking at that and making a decision for yourself. I will say, you know, a couple of you brought up, you know, continued advocacy for you that we actually are working on today and submitting tomorrow to the state public health and local public health, you know, encouraging them to allow early access for early educators to the vaccine. So certainly, you know, by your choice, but wanting to promote that you all have been on the front lines of this pandemic. And, you know, certainly we want to advocate that you are on the same tier, at least as K through 12 educators, and can be in line for that. So we will be submitting that request and wanting to support you. I don't know yet. The state is just in the last week kind of rolling out their plans for their vaccine plan. So we'll be following that and can be sharing more information with you on the COVID Resource Center.
Stephanie, it's Jenny. Hi, everybody. I'm Jenny Pollard from Thread. I just wanted to let you know that right now, the only information we have on the COVID Center is a link to the state's plan for the vaccination. But we will be, as Stephanie said, as information becomes more readily available, we'll be sharing that. But you can find the plan through the COVID Center.
Great. And I like the suggestion of maybe adding a few links about the science of, you know, knowing about, you know, trusting the vaccine and what's available. So we can share that. I'm sure there's some on the CDC website. Cassie, do you want to share, before I'm going to just close with a few next step slides, but do you want to share really quick just what hands-on supports are available right now?
Sure. So we are doing everything by distance 100% right now. The CDA verification visits is not something Thread can do on site. The CDA Council has provided extensions for people for their application if they weren't able to get their CDA verification visit or testing done within the period. I see Heather, you got your hand up. I'll get you. And while the CDA Council does allow that and does have some, I wouldn't say regulations, but some suggestions on how to carry that on safely, we've decided this time not to do those on-site verification visits. We do have a letter that we have drafted that we can supply to any of you that you can use if you need to send to licensing for a variance, to show that this is not punitive of you. This is not on the educator's end why they couldn't get that. Something else that we have been doing is we have been contacting people on the CDA Council's website. They have the list of the local people that are qualified to do that. Many of them did not return our calls, or if they did, they said they're not doing that on-site work right now. So we were trying to identify who in the community was doing those across the state. Unfortunately, we can't find anybody right now. Is your question related to CDA, Heather?
Yes.
Okay, go.
More of a statement. I actually called the council last week and talked to them about it, see if there's a way around it. They said there wasn't, but that people are allowed, or not allowed, are suggested and requested to actually go become PD specialists if we want to go out and do it. But I was actually interested to hear that you are also having trouble getting other professional developments or development people to respond.
Yeah,
I've been having that problem myself.
Yes, we've been working to identify who's out there. If we can't do it, who can? And they're either not returning our calls, or the couple that did, and we've called across statewide, not just limited to Anchorage, they're saying they're not doing them. So like I said, in absence of that, I do have a letter from Thread that you can use. You can request from me. I'll put my email in the chat here in a moment. And you can submit that to licensing, and then licensing has questions. They can come back to me on that as well. As a way for you, your educators, if they don't meet that education requirement for licensing, you can have a variance to say we have a plan, or we need an extension, and here's why. Other on-site work, I mean, any kind of consultation work, or, Heather mentioned how, behaviors and having those like individual child consults and those goals, we're not doing that on site right now. We are trying to figure out ways to do that by distance. It's really difficult to do virtual visits and cameras because you have to get permission from every family to do those. However, as much as possible, we are here and we're willing to do that by phone, by email, by Zoom. We can set up meetings with you one-on-one or with your staff. So those things are still available. We're making adaptations to that work, but it's still available. So I don't know if there's additional questions.
I have one, but it's for the centers. Are you guys willing to have development specialists come out? I know my center is, but I don't know if anybody else actually is willing to have outsiders come in.
A question for the larger group? Yeah.
Yes.
Yeah. And feel free, Heather, I want to, maybe I'll ask people to share that information in the chat as kind of a sidebar, pun intended. And I will just, to be respectful of people's time, I'm going to close for the last few minutes here, but you all, if you want to, you're welcome to stay on for a few minutes, and we can continue that conversation. So I'm going to share my screen again for a minute. One, share. We'll see if this works. Okay. For the last few minutes here, just want to talk about what we're going to do next and what our focus is. I'm glad to hear that your needs and what's surfacing for you align with our anticipated next steps. We know that there's continued funding needed, number one. So we need a federal stimulus. Somebody already brought that up. So Congress is debating a federal stimulus right now. I will ask Jenny if you can put in the chat how people can take action. You can click on this as your final action tonight or at any time from our website, and send a quick note to our national delegation that we need more federal stimulus support. We know that families need more support in order to access affordable childcare, and we'll be, looking to how the state can help as well. And we want them to at least continue stable support for early childhood programs. So We hear you loud and clear that continued mitigation efforts, risk, and a need supplies is huge. And we want to continue to hear from you. Your feedback tonight is super helpful. So we want to continue to fundraise and advocate for what you need next. What we are going to be doing is continuing to collect information from you. And we want to continue to educate policymakers and those decision makers around policy and funding, what's needed for COVID relief. We, as I mentioned, want to connect more with the business community to understand what they'll be doing next with their workforce, and really want to also focus on how do we build the system back better. I think, you know, we all can see that COVID has shown us all where there are some cracks in our system that need to be rebuilt, and we have an opportunity to have that conversation as well. So want to thank you. As Cassie said, we're available for you and want to support you in your ongoing needs. So please continue to share feedback with us at any time. We're here to help and listen. And in the new year, we'll certainly be looking at how we can continue to support you. So I'm going to officially close here now. Cassie can share how to get full credit tonight with an evaluation. We'll say our good night, and you are welcome to stay on for a few more minutes if you want to continue the conversation.
Great. Thank you so much, Stephanie, for being here tonight. And Melinda and Jenny for your support. Just want to remind you, last chance, if you have multiple people on your device, please put all their full names in the chat so they get a 10 credit for tonight. I've put the class code and the link multiple times in the chat to do the evaluation. You do have to complete the evaluation to get credit for tonight and for us to send you a certificate for this training. I'll stay on for a while if you need help or need support with that evaluation. If you're on the phone, the class code is SC121720. Again, that's SC, S as in Sam, C as in California, 121720. You should be able to just hit that link. Many of you have taken training from us before. Go onto the survey, enter the code in your excuse me, feedback.
Thank you, Cassie, and all for attending. While you're finishing up your evaluation, I just want to say happy holidays to all of you. Thank you, and stay safe and well, and we look forward to seeing you in the new year. Thank you.
Thank you, Stephanie.
Thank you.
Thank you. Thank you, Kazi.
Oh, you're very welcome.
Thank you.
I'll stay on to help with evaluations, but you're free to go whenever you've accessed that.
Okay.
Thank you. Thank you. Have a wonderful night.
Thank you for coming, for all of your feedback, everybody. It's really helpful.
Thank you.
Thank you. Appreciate all the comments and the discussion. Happy holidays to you too, Joan.
Stephanie, I had a question.
Yes, go ahead.
Thank you.
Sorry.
Muchas gracias.
I was wondering if there was any discussion amongst like ASD and the school board and their plans and the early childhood field or the youth development program field, and when they're making their decisions, how that impacts. Like, I was just wondering if they like communicated with you at all to figure out, or if that was just not on their radar.